Traumatic events can trigger various mental disorders. Exposure to traumatic events is commonly associated with post-traumatic stress disorder, PTSD. Quoted from Psychiatry, PTSD is a psychiatric disorder that can occur in people who have experienced or witnessed traumatic events such as natural disasters, accidents, terrorism, sexual harassment, violence, bullying, and so on. However, not all trauma can be said to be PTSD. What is post-traumatic stress disorder, PTSD? PTSD is a mental disorder that occurs after a person experiences or witnesses a traumatic or unpleasant event. Quoted from Medical News Today, PTSD is estimated to affect 7 to 8% of the world's population. However, women have a higher risk than men. This is due to the large number of women who are victims of sexual harassment which causes trauma. There are also symptoms of PTSD sufferers followed by excessive anxiety and repeated memories of the trauma that is felt. Quoted from Psych Central, PTSD can also cause various physiological effects, such as decreased immune system function to trigger chronic diseases, such as heart disease or diabetes. That is why, people with PTSD tend to have a higher risk of complications. In fact, chronic PTSD can lead to premature aging such as neurocognitive disorders and strokes. Symptoms of post-traumatic stress disorder, PTSD. Quoted from Psychiatry, PTSD symptoms fall into 4 categories, namely, 1. Intrusion. People with PTSD often remember events that traumatized them. In fact, sufferers feel as if repeating the incident. Memories of traumatic events are also often present in nightmares, so sufferers tend to feel emotionally depressed. 2. Negative thinking. PTSD disorder makes sufferers blame others or themselves. In addition, sufferers will also feel hopeless and lose interest in the activities they like. In fact, PTSD can also make sufferers more alone and difficult to establish relationships with their environment. 3. Tendency to avoid. People with PTSD are reluctant to talk about or think about events that traumatized them. Therefore, sufferers will avoid activities, places, and things related to the traumatic event. 4. Changes in emotions and behavior. People with PTSD are often irritable or fearful even if they are not triggered by a traumatic memory. These changes in behavior often endanger themselves or others. Emotional changes that occur in people with PTSD are easily afraid, always alert to danger, self-harming behavior, difficulty sleeping, difficulty concentrating, and having excessive feelings of guilt. How to overcome post-traumatic stress disorder, PTSD sufferers often struggle with intense anxiety symptoms. In fact, PTSD symptoms can affect your overall quality of life. To overcome this, most PTSD sufferers are tempted to use shortcuts, such as consuming alcohol or even drugs. In fact, quoted from Medical News Today, here are some much better ways to help anxiety symptoms in people with PTSD. 1. Meditation. Meditation has been shown to be effective in helping manage various disorders. In the case of PTSD, meditation can help sufferers reduce avoidance and self-blame. The focused strategy is to regulate mood and reduce symptoms by calming down. 2. Doing physical activity. Many people with PTSD say that doing physical activity can help them deal with stress symptoms. Researchers from the University in Cambridge, Anglia Ruskin, found that surfing can be a therapy for PTSD sufferers due to war trauma. This sport helps veterans focus. 3. Utilizing aromatherapy. Some people diagnosed with PTSD say that aromatherapy can be a helpful and effective relaxation strategy to reduce stress levels. David Kuchin, a writer and former police officer who was diagnosed with PTSD in the 1990s, in the book Post-Traumatic Stress Disorder, The Invincible Injury, mentions that the effects of aromatherapy can be part of healing by preventing stress. 4. Art therapy. In the Journal of the National Center for Biotechnology Information, U.S. National Library of Medicine, art therapy has been shown to be effective for treating PTSD. PTSD sufferers who undergo this therapy show good progress. They feel more relaxed, are able to pour their emotions and memories into their work, have less memory of traumatic experiences, and become more self-confident. This type of therapy aims to help individuals get their emotions out. In fact, this therapy is used as a learning tool to overcome negative memories. That's the video this time. If you think this video is useful, please give a thumbs up, subscribe and share with your friends so we can continue to provide interesting content. Thank you for watching.